to summarize, irregular periods, difficulty in conceiving, excess body hair, weight gain, difficulty losing weight, skin tags, signs of insulin resistance, that is, acanthosis nigricans, acne, oily skin, male pattern baldness or thinning of hair, and all, ovaries that have large cysts. So what are the other problems which can contribute to female factor fertility? That is fertilization problems. Now, the anti-sperm antibodies and oocyte membrane proteins. So this is immunological part of female infertility. So the developing embryo, which gets miscarried due to the mother's immune system, is recognized as a foreign body, and that's the reason the mother's body starts attacking it. So this is what is meant by immunological infertility. Again, the embryo might be rejected because, see, this embryo is going to have 50% of the chromosomal material from the mother and 50% of the chromosomal material from the father. So now if this embryo is trying to implant itself to the uterine lining, the body might just acknowledge the 50% paternal part and will reject it, considering it as a foreign body, and hence implantation does not occur. Or if the implantation occurs, that embryo might get miscarried. Means this patient might land up into an abortion, spontaneous abortion, or missed abortion. Also, if when these kind of females, when they get exposed to the sperms in the vaginal tract, thus their body starts producing anti-sperm antibodies. So when recurrent, when they have sexual intercourse frequently, these anti-sperm antibodies attack the sperms, and hence there is infertility, because obviously the sperms are getting attacked, so there is no way where they're going to reach the egg and fertilization is going to occur, and hence they face problem immune factor. These patients are termed as immune factor infertility. So membrane proteins. Now egg, that is the oocyte, has certain receptors, and it has a protein known as receptin, which is responsible for binding the sperm to the egg for the process of fertilization. Now, in such patients who with immune factor or with oocyte membrane proteins, this receptor may not be present, or if it is present, it is not responsive, and hence the fertilization doesn't occur. Now, developmental problems as in the egg or the oocyte has a very hard zona pellucida, hence the sperm will not be able to penetrate into the egg, and hence there is a fertilization problem there. Or even if the sperm fertilizes, even if because of the hard zona present, the resultant embryo is not able to hatch itself outside and outside to implant to the uterine lining. And hence in such cases, when we come to know about these cases when we take them for higher treatments known as IVF or ICSI. The zona is so hard that the blastocyst is not able to hatch itself outside. So in such cases, what we do, like here I've written, the scientist can make a tiny hole. This is known as laser assisted hatching, as in we create a small break at the level of the zona so that the embryo is able to hatch itself outside and implant to the uterine lining. So what are the treatment options for female factor infertility? Ovulation induction in cases like PCOS or ovulatory dysfunctions. You give them ovulation induction agents like letrozole, clomiphene citrate, or even gonadotropins, which is gonadotropins are combination of FSH and LH hormones. Ovulation, or in cases where the grading of infertility is quite higher, we can offer them treatments like intrauterine insemination, or the third parameter, like the most highest form of treatment, is IVF or ICSI. Thank you.